Story County, helping build Nevada's future.
Welcome to Nevada Newsmakers. I'm Randi Thompson, sitting in for Sam Shad. Today we're talking to Barry Duplantis, the CEO of REMSA Health, on how healthcare is changing in America. Coming up on an all-new Nevada Newsmakers.
A power line is more than a power line. It's maintaining the bottom line for small businesses. It's keeping the assembly line moving for our workforce. For our brightest minds, it's meeting a deadline. It's on the front line with our heroes. And on the sidelines of the biggest games. It's a direct line to our loved ones. And it's a lifeline for the most vulnerable. There's a lot on the line.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
My whole life has been public service. It's about people. And when we work together instead of yelling at each other, we get things done. We don't always get everything we want, but that's our system of government, give and take. We don't give up, we keep working, we keep pushing. And when we break ground on Nevada's first children's hospital, when crime rates come down, and when graduation rates improve, that motivates me. That's why I do it.
Meet Nevada Health Link, Nevada's official health insurance marketplace. Your link to savings, selection, free assistance, and name brand health insurance, where 90% of enrollees lower the cost of their monthly premium. Everyone deserves access to quality health coverage, no matter your income or family size. Visit NevadaHealthLink.com. A few minutes could save you hundreds of dollars per month.
Nevada Health Link. Our plans are made for your plans.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
Back on Nevada Newsmakers, I'm Randi Thompson, sitting in for Sam Shad, and I'm joined today by Barry Duplantis, who's the CEO of REMSA Health. Hello.
Hi, Randi. Thank you for having me today.
You bet. You're one of my favorite people, so I love having you on this show.
Thank you.
And, because I've used REMSA Health, as you probably know, my husband and I used it not too long, about a month ago. So I'm very grateful for REMSA Health. A lot of people see REMSA Health as the ambulance company in town, but you guys are a lot more than that, aren't you?
Yes. In fact, let me simply say, increasingly, the way folks use EMS in communities around the nation actually is changing because as we see things that we read in the news with regard to changes in healthcare, folks throughout the nation are using 911 to access healthcare more than ever. And particularly as people fall off of insurance plans or the premiums become too expensive, people become uninsured or underinsured and rely on our EMS services to help them in times of need. So in our case, fortunately, we are able to serve as a high-quality safety net to healthcare in our region. And it starts when the phone rings because all of the folks that answer the phone in our dispatch center are all medically trained, at least at an EMT level. So when we are answering the call, we're able to triage and align the patients with the right care.
So it's not just 911, what do you need, we're sending an ambulance. You guys have actually some other ways to kind of talk through a situation with that person, whether they actually really need the ambulance or not, right?
That is correct, because in many cases, we're able to solve the issue right on the phone, because in the course of a year, we generally take in about 250,000 calls. And then of that 250,000, we end up responding on about 100,000. So you can see there's about 150,000 instances that we can resolve on the phone and not dispatch an ambulance. And then of that 100,000 that we do dispatch, about 35,000 times we're providing care in the field and transport's not necessary. We're able to take care of the patient, and when we do that, there's no charge. There's no charge for dispatch, and there's no charge for us arriving on scene and providing care, on the scene with the patient. There's only a charge when a patient is transported, actually, and that happens about 65,000 times a year when a patient is actually transported. And even then, we go back and we start, if you were to really look, so what's the impact on the citizen in terms of the value that REMSA provides to the community? Of those 65,000 patients that we do actually transport, most of them are actually covered by insurance.
Okay.
I'd say 1 in 10 actually probably don't have anything at all. So basically 2 in 10 would be like a commercial insurance, 4 in 10 would be a Medicare, a 3 in 10 would be a Medicaid, and 1 in 10 would be, no insurance at all. So that's how we actually provide the safety net of emergency care. And as you well mentioned, that care can go from something that's an extreme emergency where life is really at risk, all the way to something that's very low acuity where someone maybe just has a fever and not sure what they should do.
So you actually have nurses that they transfer to a nurse, correct? And the nurse can talk to that person. If they don't need transport or it's not a medical emergency, maybe they just have a question. I just took a drug and I don't understand the interaction. I mean, you guys are providing care at various different levels.
We are providing care at different levels within our dispatch organization. However, as I mentioned, healthcare is evolving. And we did have nurses until about a year and a half ago. And we've actually, because of COVID actually fast-forwarded everything immensely, because our callers basically said, I don't want to talk to a nurse. I want to talk to a physician. I want somebody who can prescribe to me. And so with COVID, we started learning about things like Treat in Place, where we can interface with a physician in the field.
Oh, wow.
So there are so many changes taking place. And then to the next wave, many of our viewers, are being inundated with AI and its capabilities. That's going to also filter in to the things that we do. Now, we're being very cautious as to how we integrate certain things. So right now, where we are looking at using AI as an augmentation to our services, it's on the QI, the quality assessment after the fact. Are we doing the right thing? Would the decision have been different? So we're testing AI capabilities on the review side, but I anticipate that it's going to become more integrated in the complete EMS process, not only in our system, but throughout the nation. Because just to digress here for 1 second about our system, because I'm so proud of it, we've got one of the best in the nation. In fact, folks come from all over to look at what we do and how we do it. And so as we continue to try to improve and do better than we've done before, each day is a learning experience where we try to improve the way we do business. As a 501c3 not-for-profit, we are a not-for-profit organization. We're not subsidized or receiving any government support. So much like any family, we have to live within the confines of the resources we have. So it forces us to always look at how do we do things better than we did before.
The AI component is a fascinating one. But I'm glad to see it. You're on the review side, not yet on the ChatGPT. How do I, stop doing this or something? Although I have used ChatGPT a few times because it'll say I'm not a doctor, but if you give me the give me the drugs here, I can kind of tell you some possible interactions. So it's fascinating to see how AI is becoming a kind of a medical component. All right, so you touched on the fact that you're a nonprofit. I think a lot of people think you're a government agency. So kind of explain the organization of REMSA Health.
So REMSA was set up about 40 years ago. In fact, this year is our 40th year for the REMSA ground ambulance service. CareFlight, actually part of REMSA as well, has been around for 45 years, 5 years longer than the ground service. But 40 years ago, the community was in a mind's eye to create a system that the community could govern and monitor, but it not be reliant upon government. And I will proudly say in this day and age where there's so much anxiety with regard to government services, what can I count on, what is at risk, what's being cut, what's going away, I'm proud to say that REMSA as a standalone not-for-profit controls its own destiny. We are governed on the ground side. Our franchise is governed by the District Board of Health, which gave the REMSA the right to operate ground ambulance services through an interlocal agreement, quite candidly, 40 years ago, where the three governments gave their sovereign obligation to do EMS to the District Board of Health, which then created REMSA. And REMSA is very health-centric. It's the other thing I might add, because as you talk about, what is REMSA's non-government, so how does it work? REMSA has representation from all three health systems on our board. We also have other appointed members. We have an accountant, an attorney, and a consumer at-large person appointed by the District Board of Health. We are completely on the ground side. All of our quality metrics, our performance, we review every single month with the District Board of Health. We stand and report on how we do on compliance with our franchise agreements, which includes things like how quickly did you get to scene, what were the top things that you responded to, and we do that for what we call priority 1 calls as well as priority 2 calls. And priority 1 calls would be like those more emergent and higher acuity things, where the lower acuity might be, I fell, twisted my ankle, kind of thing.
Kind of non-emergency stuff. Okay.
Correct.
We're going to take a quick break. We'll be right back after this.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
The trucking industry is the most resilient link in the supply chain. And for over 90 years, the Nevada Trucking Association has been the voice for the men and women in the trucking industry. From Carson City to Washington, D.C., we advocate for policies to protect our trucking companies and keep commerce flowing. Because Nevada's and America's prosperity is tied to trucks. There's nothing without trucking.
This summer, all roads lead to Hobie's Casino for trucks or bucks. Win up to $1,000 in cash every week. Then buckle up and win a brand new Tacoma or $35,000 in cash. Shift the winning into high gear at Hobie's Casino.
At Nevada Urban Indians in Reno, your health is our priority. Our medical clinic welcomes everyone. We accept all insurances, ensuring quality care is within reach. Nevada Urban Indians, your partners in health.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
This is Nevada Newsmakers.
Back on Nevada Newsmakers, I'm Randi Thompson, sitting in for Sam Shad, talking with Barry Duplantis from the REMSA Health, the CEO of REMSA Health. So I see ambulances parked all over town. And I remember back in the day, you guys had, you had your hub and you came out from the hub. You guys don't do that anymore, do you?
No, actually, we use a bit of analytics. It's actually, this is simply called predictive analytics, which we essentially look at the data of where we respond, when we respond, the time of day, the day of the week, the month of the year. We look at the patterns. And we actually position ambulances all over the community based on where we anticipate calls to come from. Pretty accurate. So it puts us closer in terms of our ability to respond to the caller. It puts us closer to respond when we're already in the ambulance, because essentially all we have to do is press the gas and start driving. So there's very little latency from the time we get the call to the time that we start rolling our wheels to the call. It also does an important component satisfies an important component for the community, and it's that we don't have to build stations because we, being mobile, can park anywhere there's room. So it can be a Raley's parking lot, a grocery store, a Walmart, typically a Maverick, because we use a lot of gas.
That's where I see you, the Maverick on DeMonte. Yeah.
Yes. So we are positioned in the community. So one of the things that I've come to really appreciate over time, which is just an added benefit, because I've lived in Reno for the past 32 years, and I've seen the community grow from vastly from where it was in 1994 when I first moved here. And the one thing I can attest to is the growth in our community has been all over. It's not just a particular area. And so for that reason, the model that REMSA's got, where we can just be dynamic and position as neighborhoods get built, ready to serve, because we're based on the call demand. And so we're able to deploy overnight. It's a very dynamic model where we look at where the calls are going to come from, at the day of the week, time, year, for example. If it's day before Christmas, we would definitely be around Meadowwood Mall, for example.
That makes sense.
Lots of shoppers, so those things all factor into how we position ambulances around town.
Oh, that's fascinating. So I had the honor of and the privilege of touring REMSA Health and seeing your call center. And I had a meeting with some county commissioners recently, and they're talking about consolidating fire, consolidating police, but also consolidating the 911 call center. How does 911 work in our area?
That's a complex question, and I will do my best to kind of lay it out, because it certainly comes with a lot of confusion, because when most people don't have landlines anymore.
Right.
So most people that are making calls on cell phones, and those cell phones are captured by cell phone towers. And there's more accuracy now with where the call is originating, where the phone is physically standing. But it depends. So the call will first go to a cell tower, which will either be a Reno cell tower, a Washoe, or a Spark cell tower. We call that a primary PSAP, a primary answering point. And then at that point, that's when they initially answer the call and say, 911, what's your emergency? If it's medical, then the call gets transferred to REMSA, where we have the medically trained folks triaging the call. But as you can see, the call's being answered by one person, now being passed to a second person for the triage. So there can be some latency from the initial answer to the time that REMSA gets it. Typically, when REMSA gets the call, the wheels are rolling within 26 seconds or so of the time that the call arrives, because we're capturing the name of the caller, the address, and the phone number, and we're triaging the call. But as the call's being triaged, depending on initial indication, if it's a heart attack, stroke, drowning, those kinds of things, wheels are rolling immediately, because we know it's very high acuity. Lower acuity, we would then prioritize to provide the right response for that particular caller. And why that's necessary, just to digress on that a second, is we always want to make sure that we have the appropriate resources reserved for the super high acuity calls, the strokes, the heart attacks, the drownings. We absolutely want to make sure we have resources to cover those. But to the point of the dispatch, it's a popular topic on a lot of people's minds, because it is an issue, and I will say that we are addressing it. And I don't know that the community typically gets as much of an update as maybe they might like, but we did an interlocal agreement. I say we because I live in the community, back in, I believe it was July of 2022, where the three communities got together, the three government agencies, and established an interlocal agreement to revisit the response to an emergency medical call. And the first bite at the apple was dispatch. And there is a dispatch project that we are collectively, Washoe County, City of Reno, Sparks, ourselves, we're collectively working on. And because to the point of many folks in the community, wouldn't it be nice if everybody were on the same system? And the answer is absolutely yes, it would be. Because right now we have 4 different versions of reality. And so getting everyone on the same system is the right thing to do. It is being worked on. It's moving a whole lot slower than anyone anticipated, but it's not a governance issue as to why it's moving slow. The vendor has had some difficulty delivering on some of the things that we've asked for, particularly on the law enforcement side.
Okay. Yeah, was it the hexagon or octagon or
Yes.
hexagon?
Yes.
Okay. Yeah. And I heard there's
initially it was called Hexagon, then the company changed its name. It's now referred to as Oxagon. And as I understand it, the expected go live right now is looking like early 2027. Don't hold me to it because I'm not the vendor, but that's what I'm hearing.
Yeah, so it sounds like technology has to kind of catch up with everybody.
Correct.
Yeah, okay. I think it's fascinating too that we've consolidated stuff in Las Vegas, but I guess we've kind of consolidated Reno police and sheriffs since the sheriff's department's taken over the Reno Police Department, but we won't go there at this point. So you talk about a franchise model. Can you kind of explain that to me and how? And because again, I think people think that you're a government agency, that we pay our taxes pay for you, but you have a franchise model that actually kind of dictates your funding.
Yes. With regard to the average bill, the franchise model dictates the community's expectation for response times and the quality of service that we provide. We've got several different reporting criteria built into the review process of the franchise agreement, and we always exceed it. I mean, our goal is to exceed, not to minimally meet. But as the community grows, I mean, we're constantly growing with that. Adding more ambulances, adding more people. The organization is now over 600 people in size.
Okay.
So we've become a rather large. I probably, from an accounting perspective, I describe us as a mid-sized business at this point. So we have grown, and getting back to that franchise model, it covers what the community's expectations are and our accountability in coming before the District Board of Health every month to acknowledge. Here's how we did the previous month, and we discuss any issues that might come up, any issues that any of the members of the District Board of Health might have with regard to our performance, anything that they've heard, or any questions they might have. Sometimes it's even an extraneous question. Maybe. For example, this is just one example where it's kind of out of the ordinary, but when there was a shooting last year at the GSR, for example, we came together very quickly. I was on the phone with Renown Medical, with the Trauma Center, with the District Board of Health, with Reno Fire and police. So we were all coordinated immediately literally within minutes. And actually, it's one of the things I would cite as a strategic advantage of REMSA being that single EMS provider of service in the community, because it was simple to organize a response to take care of patients as this event was unfolding.
So it's showing really how this franchise model is kind of working in that sense too.
Absolutely.
Yeah.
Absolutely.
We're going to take a quick break. We'll be right back after this.
Welcome to Story County, where history meets innovation, and a pioneering spirit continues to shape our future. At the heart of the Tahoe Reno Industrial Center, we power the future with global leaders in technology and manufacturing, driving progress that reaches far beyond our county lines. From advanced manufacturing to tech innovation, our industries are creating thousands of quality careers, fueling a vibrant economy that benefits every Nevadan. But it's more than just growth. Our community is our foundation, supporting families, empowering local initiatives, and creating a place where everyone belongs. Be part of a legacy built on bold ideas and boundless possibilities. Join us in building a brighter future right here in Story County. Story County, helping build Nevada's future.
Light up your July at the Carson Valley Inn. Win up to $25,000 in the All-American Progressive giveaways. $1,500 winner guaranteed each drawing night. And $30,000 in grand prize giveaways. Only at the Carson Valley Inn.
We're the Peters family, 2 combat veterans, our daughter Elle, and our Liberty Dogs puppy in training, Cooper. Cooper will grow up to be a life-changing companion to a veteran with visible or invisible challenges.
We're helping Cooper build focus and confidence so he's ready to support his veteran.
And we know he will help bring happiness and independence to his veteran's life.
So join us, become a puppy raiser, and change lives, one puppy at a time.
This is Nevada Newsmakers.
Back on Nevada Newsmakers, talking with Barry Duplantis from REMSA Health. I'm Randi Thompson, sitting in for Sam. So I've only got about a minute left, but in the franchise model, you're allowed to actually bill patients. But what is the average bill cost to a patient?
Well, there is an average bill. It's like around $1,200 or so. But the reality is, most of our patients are covered by some form of insurance.
Okay. And
when I say insurance, what I mean is about 20% of our patients, 2 out of 10, are covered with commercial insurance. About 40%, 4 out of 10 patients are Medicare. 3 out of 10, 30% are covered by Medicaid insurance. Mm-hmm. And then I've got about 10% that's just simply basically self-pay or uncompensated care, for which we generally write off. So the reality is our patients are not being stuck with large bills because we're limited in most cases to what we get. Patients are obviously responsible for copays. Federal regulations actually require that. Yeah, that's part of what's
like any
required.
medical any kind of medical procedure.
Absolutely. But
cool.
most of our patients are covered, and as I indicated, when we provide care on scene, there is no charge at all. There's only a charge when we transport to area hospitals.
Right. Well, thank you for keeping us healthy and safe in our neighborhoods. We appreciate it. Barry, thank you for being here today.
It's my pleasure.
We'll be right back after this.
Welcome to the Ahern Hotel, where bold ambition meets unforgettable experiences. Feel your game day vibes and celebrate with great food at All-American Sports Kitchen, serving amazing flavors and fan favorites. Sip and savor at Aroma Barista Bar. Handcrafted coffee roasted to perfection. Step into the Ahern Live showroom, where concerts, comedy, and unforgettable performances light up the night. We also have the David Yule Art Gallery. It's the only one in the world, and his work is breathtaking. Browse the gift shop. It's a treasure trove of keepsakes, chic essentials, and one-of-a-kind finds. And the space. Almost 30,000 square feet of meetings and events areas ready for you. From weddings and birthdays to quinceañeras, trade shows, banquets, and beauty pageants. Bigger ideas? Let the Ahern team handle all the details so your event is flawless. Ahern Hotel, where moments become memories. Book your next gathering today.
Each day, the Children's Advocacy Alliance partners with leaders, legislators, and families across Nevada to improve children's health, education, economic well-being, and safety. We recognize Nevada will be no better than the state of its children. Be a part of this change. Be a supporter of the Children's Advocacy Alliance. For more information, go to CAANV.org.
Imagine a magical garden that feeds Carson City's hungry and homeless, teaches our high school students agriculture, creates hanging floral displays to beautify downtown, and yet charges nothing. It's not magic. It's the Greenhouse Project. It's real, it's growing, and it needs your help. Go online to carsоncitygreenhouse.org so together we can grow it forward.
Thank you for watching or listening to Nevada Newsmakers. Check us out anytime at NevadaNewsmakers.com. Thanks for watching.